Welcome to Segment 2 of our Community Readiness Assessment training. Segment 2 is going to focus on why we need to measure community readiness. But first, let's start with a brief review of the first segment. In Segment 1, we provided an overview and really started introducing the importance of community readiness to coalitions and communities. Today, we're going to discuss why we should measure community readiness, and we're going to really get into articulating the benefits of conducting a community readiness assessment in your community. I'm Matt Corser from the leadership team of the Strengthening and Sustaining Ohio Suicide Prevention Coalitions Initiative. Because this is an asynchronous training, on the webpage you will find this video, and you will also find supporting materials which include a PowerPoint slide deck of the slides that we're going to cover today. Let's start with segment number 1, defining community readiness. It is the degree to which a community is willing and prepared to take action on an issue. We're talking about support and commitment of community members. We're talking about resources. And readiness is going to support the actions that you need to take in your community to affect change. Also, as a reminder, community readiness is not static. It doesn't stay the same way across time, across communities, or across issues. It's something that you likely will need to circle back to in time to measure again. We talked as well about measuring community readiness through doing a community readiness assessment. And that all that is a systematic method for assessing the level of readiness of a community. And in Ohio, many communities have used the Tri-Ethnic Center model for community readiness. So let's focus now on some of the benefits of doing a community readiness assessment. Let's look at our starting point, which is really a common experience many of us have had as we've worked with communities. Here we are on the right. We're a coalition member. We can take interventions, we can take strategies, we can take our help and time and our skills to a community. And in the case of community A, we take it there. The community comes together and a light bulb goes off. But we can take that same set of tools, the same strategies, our same experiences, and our same offers of help, take it to another community, and it cannot work. And that's really been one of the challenges that we've all experienced as we've worked in our communities and tried to improve the health and well-being of community residents. One of the big reasons that we can have this differential impact on communities using the same tools has to do with readiness. And this is really where we're going to start as we talk about why assessing community readiness is important for your community. So let's talk a little bit about the importance of community readiness. In many cases, what you may find when you're working to address an issue is that your community's level of readiness may not be high enough for your coalition's work to be successful. You may find that your community is not ready to mobilize. Your community may just not be willing to work with you on that particular issue at that particular time. And one of the things we've found has been it's a paradox of readiness. You and your coalition are more ready oftentimes than your community at large may be. And that's really because you and your team have benefited from training, funding, and other resources that your community does not have. With a community readiness assessment and strategies to increase community readiness, you're going to meet that challenge of bringing your community closer to your team's level of readiness. So why measure community readiness? We know that a single event sometimes, but really not that often, can instantaneously build readiness to address an issue. We've seen that time and time again as communities engage and mobilize on a crisis. But most of the time that isn't the case. Community readiness can only be built through systematic and intentional work. The challenge is that how do we know what work to do? How do we know how to focus our efforts to build community readiness? And that's really where a community readiness assessment is going to come in. It's going to provide that information. Oftentimes it's part of a larger needs assessment process. But this assessment is going to give us the tools and strategies we need to build readiness, because we will know at the end of this assessment process where our community is, what their existing level of readiness is. It's important to know that a community readiness assessment in itself can function as an intervention. Through this process, which we'll describe in subsequent segments of the training, you're going to engage your community, a broad base of community members. And it may be in ways that your coalition has not done before. What we find as well is that many times people who are respondents to the community readiness assessment interviews, they might become coalition members. And for coalition members, we find that this process is going to build capacity. It's going to build skills with interviewing, with transcribing, with data analysis. You're going to get more experience with project management, with report writing and strategic planning. And it'll give you a great opportunity to practice communicating those findings and moving forward with next steps. So why is a community readiness assessment an important first step for coalitions? First, it's going to provide a focus on data-driven decision making. For health-related coalitions, the expectation often is that you all are going to make policy, systems, and environmental change. Really not so much change at the individual level. It's a community level focus. And that means really that you need data about your community. And that's one of the great strengths of a community readiness assessment. The CRA is also going to provide space for your coalition to use the mixed methods approach to collect, analyze, and report on data, both numeric data and also qualitative data or data that focuses on comments and statements by members. We've seen that a community readiness assessment can provide an early win because the process really is laid out very well. It's prescriptive. And it has a deliverable as an outcome, and that deliverable can be shared with your coalition and your community. And it's going to get you all engaged in a data-driven strategic planning process, because really, at the end of the assessment, you'll be working to develop a plan to build readiness in your community. The skills and capacities that you're going to build through a community readiness assessment are transferable. As we talked about in previous segments, CRAs have been used successfully in a wide variety of health and policy-related domains. Everything from alcohol and tobacco and other drug use, to transportation, to taxation, to head injury. And this is just a small number of the topics that community readiness has been used to assess. CRAs are great for emerging health threats. What we find oftentimes is that coalitions may find themselves working on another issue or problem that's emerged in the community. And because of this process, you've already got the skills to start to start addressing it in the community. And as we think about new issues, we know that many health issues in a community are wicked problems. They're hard to define. There's not necessarily an easy or straightforward solution to them. And every wicked problem can be a symptom of other wicked problems in the community. A community readiness assessment can be applied to all of those interrelated problems in your community. So let's talk for a minute about why we need to assess community readiness to engage in a comprehensive approach to suicide prevention using the CDC strategies. What's important to understand here is that if you understand your community's level of readiness to address suicide prevention using the CDC strategies, and you're able to work to increase your community's level of readiness to use those strategies for suicide prevention, you really are going to position your coalition and your community to have an important and meaningful positive impact on suicide as a public health problem. And that's going to improve the health and well-being of your community. So let's talk a little bit about where we've come through this web-based training process and where we're headed next. In part one, we provided a broad overview of community readiness and how to assess it. This segment of the training really focused on understanding the value of doing a community readiness assessment. It focused on the value proposition for your coalition. In other words, why it is worth it to do a community readiness assessment. The next session, which we're titling Nuts and Bolts, is going to do a deeper dive into the triethnic model for assessing community readiness. It's going to position you to build skills and is an important part of the planning you'll engage in.